Good afternoon, everybody. Really pleased that you could make it this afternoon to our session on going linear. And just to reassure you, this session should answer most of the questions you've got regarding our subjects in health and social care, and hopefully it should reassure you that not that much is actually changing. There's going to be two parts to the presentation. The first part of the presentation is one that's generic to all subjects about the reforms from September 2012 and going linear. So a lot of the information there is general. I've added the extra slides about health and social care and any implications it has for us. So basically you need to bear with me as I go through the first part, as I go through those fairly steadily, and then when I get to the second part it'll certainly become apparent the impact it has on us. I'd like to probably highlight for you that the main change really will not be to do with content or controlled assessment or exam style. It's more to do about how you choose to manage your course and how you choose to register and deliver single or double award, because there are different approaches you can use. So without any more ado, let's move on to some of the changes which are taking place. And I'll just go through these very briefly with you. So Ofqual has confirmed the following changes for all GCSEs in England. The decision has been made that all GCSE assessment is to be linear in structure, so that exams are taken at the end of the course, and this affects two-year courses starting this September and for anyone who has started their course in September 2011. In some subjects there will be additional marks that have been added to assessments and exams for spelling, punctuation and grammar, and those apply to the subjects you can see there, which is English literature, geography, history and religious studies. Units cannot be resat before a cash-in. So the main aim of some of the changes is that when you're delivering a course, whether it's single or double, you cannot resit units, which I'll return to, because there is some difference for us in health with having single award and double. The actual availability of the exams will only now take place in summer, so that will be the only opportunity. That will be apart from students who start this September who are going to do single award in 1 year and complete in September 2013, who are still allowed to do the modular approach. And controlled assessment can be conducted at any time, but can only be submitted at the end of the course. So we're going to have quite a complicated diagram here, which I'm going to pull up all the different parts of this diagram for you, which obviously you can peruse yourself at a later date. So there's a timeline here going from September 2010 right through 2015, and the main thing you need to be aware of for us is that for all two-year GCSE courses starting in September 2012, candidates will be applying for their award in 2014. So that's highlighted for you there, you can see on your diagram. Candidates who started a three-year courses in September 2011 will be expected to apply for their award in summer 2014, and therefore will not need to enter for all units in May and June 2014. So if you have started doing it over a three-year period, it will be at the end of 2014 when you actually receive the award for the students when they're in year 11. Candidates who apply for certification of subject awards in summer 2013 will be permitted to enter in a modular way. So if you decide to start in September 2012 on a single award, health and social care, to complete in 1 year, you would be able to claim that in the summer of 2013. And it says for all students taking modules in English literature, geography, history, religious studies at GCSE, external assessments taken from January 13 will include additional marks for spelling, punctuation and grammar. So that's just for those subjects. It doesn't apply to us in health, but it's just for your general awareness that you need to know that that's happening, because your students will be aware of that. So, when we're looking at the GCSE reforms, really it's minimal change for specifications, with the exception of those subjects introducing the spelling, punctuation and grammar. Edexcel have no plans to change the subject content of the specifications as a result of those reforms, and the GCSE reforms will affect the way external assessment is taken rather than the actual external assessments themselves. So what we're saying to you there is it's just when you get them, not what the exams will look like, and that will apply to our subject as well. There's no change in assessment style. Candidates who have to take all GCSE assessments at the end of the course for awards made for summer 2014. So it's very clear here that it has to be in summer 2014 when the assessments actually take place, if it's on a linear 2-year course. And the GCSE examination series will be restricted only to May and June, apart from English language and mathematics, which will have an opportunity for retake in November. So I suppose that is significant to us because candidates have been able to do a January and a June sitting, and as from 2012, if you go in linear, it will only be possible to do that in the summer of each academic year. There are additional marks for spelling, punctuation and grammar, as I've already mentioned, and it says these apply to English, literature, geography, history, RE, and the changes affect the written and externally assessed units from January 2013. So that's the start of the academic year after this. And it says marks will be allocated to questions and students will be informed which questions include marks for spelling, punctuation and grammar. So your students, as they pass through the course over the next 2 years, will be aware of that, and they probably will ask you questions on our exam is the marks for spelling, punctuation and grammar, and as you'll find out, that isn't the case for our subject. Controlled assessment, I think probably for most of us we're only just getting our heads around controlled assessment, and most of the inset we've done over the last 18 months has been regarding controlled assessment and what we can and can't do. Actually there's no change, proposed changes for controlled assessment content. Schools may continue to schedule controlled assessments at their discretion as far as this is permitted by the specification. However, controlled assessments can only be submitted at the end of the course. So that's when you're claiming your award, which is probably what most of you do already anyway. If you're doing double awards, you probably don't submit anything in year 10, you probably save it all up to the end of year 11. So no big changes for you there. It says controlled assessment unit results may be carried forward if a student wishes to retake the whole qualification. Now this will become significant to us, but I'm not going to pause at it at this stage because I am coming back to that when we look at the subject specific information for health and social care. And you are asked to note you will need to make sure that you're using the correct task for the submission date at the end of the course. I know we have odd minor cases where people have got the wrong one, but generally you just need to make sure that the submission date is the date the individual and the organisation that meets those needs, or when you're doing the pre-release material on the health promotion. So always just check that, which will probably become a little bit more significant when we look at the significance of the changes for our subject. If we're looking at unit results over 2-year exam sessions, candidates will not be allowed to carry unit results forward from one examination series to another, except where those units have already been used to count towards a single GCSE award and the candidate wishes to reuse the unit result for a double award in the same subject, or where the candidate wishes to carry forward the result from one or more controlled assessment units in order to retake a whole qualification. So there's two things to bear in mind there really, which we're going to come back to, is that it might be that some of your students are registered for a single award and then you decide to move them to double, in which case you can carry units forward, and some candidates might wish to resit the whole course, so in which case they can carry certain units forward with them, which will become clear within a minute. So I guess we're getting to the part now which is of more significance for you as health and social care teachers and for the organisation of your courses. So this section I've sort of like tailored specifically to us to try and look at the issues that you need to consider and to reassure you really. So just as we've mentioned earlier on, there are no changes to specification content. Controlled assessment conditions remain the same. SPAG doesn't relate to health and social care, so spelling, punctuation and grammar, there's going to be no changes there. There'll be nothing on the exam papers where marks are given for that. The most significant thing for us is these last 2 points, which are the range of models for candidate entry for you to consider, and the structure of the course delivery is probably unlikely to change, but it depends on how you deliver it. So it's the models we're looking at here on what you will do with your cohort who may be, just like in my centre, selecting their subjects now and may well be doing GCSE Health. So what are you going to enter them for, when, and how are you going to do it? So let's explore that a little bit more. There are 4 approaches. The first approaches 1 and 2 are all about doing single awards. So that's just Unit 1, the Human Growth and Development Unit, and the investigation of an individual's needs and how a service provider meets those needs. Unit 1 is exam. Unit 2 is the controlled assessment. So approach 1 is, you could, if you were going to complete the single award in 1 year, you could register your students for the single award modular starting in September of this year, and it will be completed over 1 year and cashed in 2013. So 1 academic year. And if you do that, you obviously can enter them for an exam in January and June, and the highest mark will stand for those students. So they still get 2 chances at the exam, and you'd submit the controlled assessment at the end of that 1 year, and you would then cash it in, and they would get a single GCSE grade. So that's because the changes are taking place over a 2-year period. So some of you might choose to do that. A second approach, if you're doing single award linear, is that you start in 2012 and you complete it over 2 years and you cash in 2014. That being the case, obviously, if you're taking that approach, they will sit the examination for Unit 1 only once at the end of the course, and they'll submit their piece of controlled assessment at the end of the course. So there might be a number of you who are doing single awards, so those might be the 2. Just need to go back one, actually, excuse me. Okay, so we have now got 2 other approaches as well, approach 3 and approach 4. In a funny sort of way, it's probably easy to look at approach 4 first, because a number of you who are offering the double qualification may well start in 2012, and what you do is you register your students for the double award, and you're going linear. So you start it in 2012, it's completed over 2 years, and you cash in 2014. So your students will then, because it's linear and not modular, you will then do both Unit 1 and Unit 4 exam at the end of the 2nd year, and you'll submit both your coursework assessments, your controlled assessments, at the end of that year as well. However, there is another approach you can look at as well, and this is where it's really up to you as to how you register your students, whether you wish to just register single or double, or whether you wish to register single and then convert to double. Because approach 3 is where what you would do with your cohort is you could register them for the single award this year, and you could register them either for the modular route or the linear route. So if I go back to remind you, just looking there, so the modular route is approach 1, and if you did that approach, they would get 2 chances at their exam with the highest mark standing. If you register them for linear, they'll take the exam at the end of the 1 year and submit their coursework. So that is one approach you've got to consider, whether you do single, modular and linear, starting in 12 and completing in 1 year, cashing in. What you can then choose to do is top up or convert it to a double award in 2013, and in that occasion you can carry over the units from the single award to the double award, and you have the opportunity to look at different ways of submitting work, where you carry certain units forward and certain units you can't. Now the next slide I'm going to go through the rulings on this for you if you were to use approach 3. So this is where you will be topping up from your single award. So let's assume that a centre's decided to do single award in 1 year, and they've decided to then convert all their 15 candidates to double award in year 2. which you can do. But there are specific rules which apply to how this can be done. So candidates who are re-registered for the double award can carry forward their Unit 1 and Unit 2 marks from the single award qualification. So in other words, what they do is they do not resit or resubmit any modules of work at all. All they do is they carry those marks forward. Candidates could be re-registered for the double award, but resit Unit 1 at the end of Unit 2 of the course and resubmit a new Unit 2 based on a controlled assessment task. So that's the next possibility. And if you do resit Unit 1 again at the end of the second year, it will be that mark that counts. So if they scored 60 at the end, sit it at the end of year 2 and get 50 it's the 50 they get. And they could resubmit a new controlled assessment task. Obviously they'd have to be redo Unit 2 again, which might be taxing in terms of time considering what else you've got to do, but the odd student might want to do that if they didn't do particularly well, but it would have to be on the new controlled assessment task, not the one they did in the year before. Thirdly, candidates could be re-registered for the double award, resit the Unit 1 examination and carry forward their controlled assessment mark from Unit 2 of their single award. So in this case, they got a good mark on the coursework, don't want to redo it, but they want to have another go at the exam, so they can then resit. And finally, there's one combination that they cannot do, and that is top up from single to double award and keep the Unit 1 exam mark but resubmit a new controlled assessment for Unit 2. That looks as if it's an unusual ruling, but apparently this ruling is because if they were allowed to do that, it would really make the qualification quite modular, and they don't want it to be modular. So really, just recapping for you there, we're in a slightly different position than most subjects, because most subjects just do a single GCSE, such as geography or history. Because we have the chance to do double, there are different routes to delivery for you to look at. So I think that's the main thing that I want you to take away from today's session, is just to consider about how you're going to deal with your entry. And I'm guessing most people will, if they do a double award, will probably just go linear. Probably just do, right, we'll register them, we'd register the double, they'll do them both at the end of the course. But there are other ways of doing it which allow resits with conditions. So you will be allowed to resit Unit 1 if you were to register for single, then top up to double, but if the mark is lower, then they'll get the lower mark. So you need to be aware of that. In terms of delivery guidance, I mean, there's nothing drastically different than what we've done before. The qualification was initially written in a structured way for delivery. If you're offering the single award, it's probably sensible to do Unit 1 followed by Unit 2 if you're just the only teacher, because obviously doing life stages and doing the pies and stuff is very basic stuff which students need to know. But I'm aware that many centres might have two teachers splitting delivery, so it might be that 1 and 2 are being delivered at the same time. Just a reminder there, make sure it's the correct controlled assessment that you complete in for submission, because we do have odd cases, as I've mentioned, where people get the wrong one. If you're offering the double award, there is more flexibility in terms of structured delivery to meet student needs, and as I mentioned, probably most centres will go for both exams at the end of the course, but it doesn't have to be that way. And if you are going to consider entering for single award and then go for top up, you need to work out which route you're going to do that with. As usual, just to summarise for you here, we've got support along the way from Edexcel for you. We've got Ask the Expert, where the principals of the unit are there who will answer any of your email inquiries and get a response to you in 3 working days. I'd hope that's happening, but keep our fingers crossed. Keeping you informed, we'll keep you informed through emails throughout the year about the reforms that have taken place and anything else that were to come on board for you. And obviously you can keep an eye on the subject page at Edexcel about health and social care for any more information. So if we're looking at a summary for you here, there is an overall move to linear assessment. Spelling, punctuation and grammar only apply to English literature, history, geography and religious studies. There's no plans for any change in subject content, so be reassured on that. There's no plans to change the content of controlled assessments. As it says here, units cannot be resat before cash-in. Obviously, we've got a bit of a proviso there with going a top-up from single to double. And exams will only take place in the summer series, not in January, which is another big change for us. And headline indicators still remain the same, pretty much the same for school. 5A stars to C, including English and Maths. English back, as many of you are aware, as we are, that's becoming more of a significance to schools now. Ofsted are looking at that. And just to reassure you that health, in terms of for the school, whether you're doing single or double awards, will count as one subject in the headline figures for 2014. But on the candidate slip, if they're doing double award, they'll get 2 grades. So it's only for measuring schools that it counts as one subject. Right, I hope that's been really useful for you, and I know there's nothing that radically different for you, it's just delivery approaches, but hopefully it's there for you to refer to. It's at this stage where I will take any questions.